Hi, I'm Leslie Lee. This is my program evaluation presentation. I'm going to be discussing Kitsap Mental Health, a large organization in my local area serving Kitsap County. This is for Counseling 6902, Research and Evaluation in Counseling for Dr. Kalisha Jenkins. Kitsap Mental Health Services is the largest mental health provider in Kitsap County. The target population is across the lifespan, serving children's, teens, adults, and families of all ages. They offer wraparound services, crisis services, mental health and substance treatment in King County. They're SAMHSA certified, so they are offering services regardless of people's ability to pay. They require people to get into care quickly. They have crisis services available 24/7. And I spoke to the director of crisis services, Philip Hernandez. Uh, Phil Hernandez is the director of crisis services at Kitsap Mental Health. He's been in that position since 2020. He says that the goal of his department is to meet people where they are. They provide wraparound services, starting with a contract with the Volunteers of America Crisis Hotline for people having crisis situations. They have mobile crisis response team with designated crisis responders. They have a short-term crisis triage center with short-term stabilizations up to 5 days for mental health or substance abuse, and they're able to do both things. So they're well suited for handling the issues that arise in the population that they're dealing with. He also supervises I'm sorry, I think I mentioned the crisis triage center, and then there's a 30-day treatment center called Pacific Hope and Recovery for substance abuse that people are also channeled into depending on need. Kitsap Mental Health covers the mental health needs in a broad sense of people in Kitsap County. The crisis department is more specifically dealing with people in acute situations. They have a process that can move people through from acute crisis and from there either into inpatient services or into outpatient behavioral health treatment or substance abuse as needed. So they have a variety of pathways that people can take depending on need. They're also they also have housing services and can put people in touch with social work and community resources again as needed for the person's individual situation. So I'll take a moment here to give you a little bit of history of how they began. This organization started in 1978 as a not-for-profit community mental health center. It was started by the Kitsap County Board of Commissioners and began with child, adult, and family outpatient services only. By the 90s, so 20 years later, they'd added youth and adult services and 24/7 inpatient services as well. Also in the 90s, they worked to create specific housing to serve the needs of people with chronic severe mental illness. They received state and local funding and purchased 12 houses to house 38 adults, and those are still in use now. It is one of the largest nonprofit organizations in Kitsap County with more than 500 employees, and they serve over 6,500 families a year. So a very large and well-functioning organization. Recent growth has included opening the Crisis Triage Center, which opened in 2018, again, for people needing 24/7 care that didn't need the level of an inpatient psychiatric unit. They also, the same year, opened Pacific Hope and Recovery. It's a center for residential treatment use. It's a 30-day program that also co-treats mental illness issues simultaneously. Also in 2021, they opened a 72-unit apartment to provide supported housing for people with chronic mental illness. So they really vastly increased the number of beds available just in the recent last couple of years. Stakeholders include clients. The clients mostly are below poverty level and pretty impaired. This is primarily a Medicaid funded organization, so most people are on Apple Health or Medicaid directly. Um, Obviously, other stakeholders, staff, the community members who have an expectation that people with mental health issues will be treated, taken care of through the system. And again, primarily Medicaid and not private insurers. So there's not a lot of input from private insurers as stakeholders. And then finally, there are local tribe members that are involved. The local tribes have some of their own services, but they do cross over. And it's an interesting process from what Mr. Hernandez was saying about how to incorporate those different voices into the stakeholder kind of conversations. They have a different way of processing the pathways that things are going to go for growth and for treatment. He was saying that they see things more in a cyclic way rather than a linear way, and that there has to be a lot of care to make sure those voices are heard. From what I hear talking to the two people I've talked to at this organization, it's a really strong nonprofit organization. It's strong financially. It has a really good system to carry people through from crisis into recovery, through inpatient if they need it, into outpatient and residential services. So it's a really comprehensive and well-functioning system. They treat people regardless of funding and primarily Medicaid. So it's helping those who are really in need. And they really are covering a lot of aspects of community need. And then finally, they have really dedicated staff members who really care and do great work. And it's been very stressful. I'll get to that when I talk to you more about the challenges, but staffing is one of the biggest challenges they've had, especially since COVID. So as I was saying, staffing is probably their biggest challenge. These are stressful jobs, and since COVID, there have been less and less workers. It's been harder to hire people, and they're just scraping by with a bare minimum number of nurses. They need more beds. They need more mental health professionals, but they've had to close beds because of lack of staff. Phil was saying that they would put out a call for applications. They'd get 10 or 15 resumes. They'd set up 10 interviews out of those resumes. And if they're lucky, 2 people would show up on the day of for the actual interviews. So it's extremely difficult to get staff for these positions. And because they're so short on staff, it puts the existing people under more stress. So it's kind of a bad cycle that they're in with, he really called it fragility, in terms of being understaffed and barely getting by. And because of that, they're having to work with the most acute people, and it's they're basically putting out fires rather than, doing the things they'd like to be doing if they had more people and more time. This is partly because of lack of funding. They don't have the money to pay people the way people are paid in private practice. So that's a huge and ongoing challenge. And because this is a really acute population, there's a possibility of assault for the DCRs, the designated crisis responders, and for some of the people working in the crisis triage center when someone's really escalated. So it can be difficult. People have to be really committed to this type of work, and it's challenging, very challenging for them to find enough people to fill the positions that they need. One other area that was mentioned as an area potentially that could use improvement was in diversity. Apparently the upper levels of management are pretty white, and Phil Hernandez, who I spoke with, is Hispanic and is one of the few apparently that is representing other cultures in the upper levels of management. So, to try to meet these challenges, he says they're really working on anti-racism and working on multiculturalism, but it's definitely a work in progress. Um, and he said that, of course, with the staffing challenge, they're actively hiring. They're continually trying to get more people, people that they have to stay, and to get more dedicated people to join. Thank you for watching and listening to my presentation. It's been an interesting process to learn about the strengths and needs of this organization and see how they're able to serve such diverse needs and such a large population. Thank you.